Well, I'm going to give you the full treatment about how marvellous Brendan is. So, Brendan Penwarden, who has an MBA as well as an ND, which is naturopath, yeah. He's a major figure in natural medicine in Australia, yay natural medicine, having spent the last 13 years researching and presenting the latest advances in medicine and its relevance to natural therapies, to health practitioners. His passion is helping people achieve their health goals. He's helped many of Australia's leading athletes achieve the performance objectives that they have through natural medicine. He points out that Westernized society is currently experiencing an alarming increase in chronic diseases, with recognised epidemics of obesity, depression and diabetes having enormous health and economic impact. For example, obesity alone cost the US at least $117 billion last year, which is alarming. And the astounding fact is that most people will die early from a chronic disease that is largely preventable. That's obviously what really gives you the juice, that it's preventable. Brendan will discuss how the corporation is ideally poised to play a dominant role in the health of their employees, and how the company is able to assist, encourage and support people in ways that can dramatically help them, their families and the organisation at the same time. He predicts that enabling executives and workers to achieve maximum vitality, enduring loyalty and a vibrant corporate culture is the future of the modern responsible corporation. Sounds excellent. So we'll look at how we can improve productivity by improving health and well-being of our employees. Brendan will showcase best practice from around the world. And of course you all know the wonderful service that is available there, where you can just go and put your feet up on a couch and they'll tell you how
old you are.
So welcome, Brendan.
Thank you, Wendy. Sorry to put you through that long introduction that I wrote quite a long period of time ago. What I'd like to do is introduce some important concepts that I've developed over time, and that I've extracted from the research that I feel is very important to us as elements of the corporate structure. One of the things that I've been getting the feel for is that throughout this summit, people have been talking a lot about the environment, and I'm an environmentalist. I'm very happy about that. As long as you don't die of a heart attack in the meantime, you can't get a whole lot done. A number of people have been coming up to me and saying, someone said yesterday that he's trying to get something done through the public service, and they can't get it done because for 7 months the CEO has been on sick leave. Now, I'll guarantee you that the vast majority of people are not achieving what I call the health potential. Your health potential, where you'd like all your employees to be, are absolutely bursting at the seams with energy and vitality and enthusiasm, and they're going to live long, long, healthy lives. And I'll just flick through some slides and demonstrate to you that we're not even close to that. One of the major significant political and medical issues of the future is chronic disease. It demonstrates here that chronic disease is the largest causing death in the world. I'm just going to move this so I can see it. It's the major cause of death in the world. It is also getting worse. An important thing here is that despite growing evidence of the epidemiological and economic impact, the global response to the program remains inadequate. So I'll just frame that for you. What is actually happening, and this is very, very relevant to developed countries, but it certainly is happening here, is that in developing countries they're very concerned about what they call communicable diseases, the infectious diseases, and lots of money is going into that. The Gates Foundation and all sorts, and the World Health Organization pouring lots and lots of money in that. As many people die from chronic diseases as communicable infectious diseases in these developing countries, but just about nothing is done for the chronic disease because it's just too hard. It's too hard for us in our society. Why are we dying of obesity and heart disease? It's a crazy, crazy thing because they're preventable. And we can't even do it for ourselves when we've got all this ability to communicate and educate and motivate. In the developing countries, it's going to become an enormous, enormous problem. And financially, Australia is in perhaps one of the best positions in the world, because we're rich enough to pay for the leg amputations and the restenting of arteries. But in the developing world, that's not a possibility. China and India have more cases of cardiovascular disease than the rest of the world combined. So that is a really, really big thing for the world. And you're going to hear about this in the future, that these people are going to be dying of a preventable disease over there, and there's nothing that can be done. Pharmacologically, we've been attempting to do it, but I'll show you evidence as we go through that there's just very little that these people have got any option.
Brendan, why heart disease in those countries? Why have they got those two?
There are as many people starving as there are obese in the countries that we think about that we're providing aid to.
It's just the rich, the unbalanced. Yeah.
They're becoming more wealthy, and I'll discuss more of the causes as we go through, but that's a surprising thing for most people. On one side of the street people are starving, and on the other side of the street they're obese, and you'll see that in India, you'll see that in all through Africa, and it's a very important factor for the economics of that country. So it's been calculated that chronic disease contributes to 60% of the 56 million deaths. So 60% of all deaths on the globe are due to chronic diseases. And it's likely to increase to 50%.
Is it 56 million per annum?
Yes, per annum in 2001. So that's actually got worse.
Yeah.
And it represents 46% of the total global burden of disease, and that's going to increase to 57.
If old age, do you naturally get chronic diseases, or do you just
You do.
old age?
No, you do. Ageing is directly associated with the incidence of chronic disease, and even that's kind of largely understood but somewhat not understood. Arthritis and all that type of thing does increase as you get older.
So it's natural that a large chunk of deaths are related to chronic disease, but you're saying they're also related to early deaths.
Yeah, so typically the research looks at the deaths per 100,000 population. I'll show you some of those, and it's just going like this. And the disappointing thing is that it's preventable. That's the most disturbing fact about these chronic diseases. 7 out of 10 people in the United States and Australia, where it says United States, the same as Australia, 7 out of 10 people will die of a chronic disease that is preventable, and they will die earlier, and they will have. When we talk about death, I mean, death is not great. But worse than death is having a really shabby, ordinary, restricted life all the way up till the end point. So that is not reflected, and it's not easy to identify and measure that type of impact on people's lives and their families and their work performance. Now, this is a very important thing. We have, in fact, been getting healthier over the last few decades at a rate in the early 90s of about, what does it say? 1.5%. Now that rate of increase in health is actually just stopped and will turn, and we're going to go backwards. So we've spent, and the cost of the economics of our healthcare has just got to a point where we cannot spend money. So we're doing something very, very wrong. We're going to start to go backwards, and there's no cash to put into this anymore. It's full. So that reversal of our health status is going to be a very big thing for us in the future. For the politically, medically, they're up against the wall. There's nothing they can do. So my major point today is this, is that who is going to step in and do it? When governments and doctors and the AMA, they try to attempt to modify this trend, they're talking to the whole populace at once, and it has to be a very conservative, achievable, distance mediated intervention. My feeling strongly, very strongly, is that the corporation is ideally suited to look at their people, assess their people, and monitor them over time in a contained, individually specific way. Huge opportunities there to arrest this preventable condition. It's just quite extraordinary that people haven't actually heard about it at this time. Doctors know about it, your politicians know about it, and they're just keeping quiet. You may have heard stuff in the media about the cost of the pharmaceutical. I'm not going to say that on.
I've heard that the current generation of children will be the first ones that die.
For the first time in the history of humankind, the children will be dying before their parents because of the increase in obesity. I'll show you some alarming figures. I got no shortage of statistics on this, by the way. Now, you may fit into 90% of the people in this country that have one modifiable risk of the number one killer in the country. 90% of people. Now, if you go to your workplace, they're actually probably overrepresented because of the stresses, and the obesity generally is higher in people that are stressed. I'll talk to that about a bit more. 90% of Australians have at least one modified risk factor for heart disease, stroke or vascular disease. That's an alarming, extraordinary thing that can be fixed, often just like that. I do it routinely, all the time. There's a demonstration of chronic diseases. That's just a slide showing that it's going to jump up. By 2020, 50% of all deaths, 50 million rather, deaths in the US will be due to chronic diseases. This is the breakdown. It's typically cardiovascular and cancers. Those two dominate. I'll just make a point on those. They're preventable, but what's causing them? If I sat someone down and asked them, what are your current behaviours and risk factors for cancer? You don't really know. If you're non-smoker, what are you doing and what could you do to prevent cancer? What are you doing that's causing heart disease that you could change? People generally don't know. So if I can identify someone's risk factors for cancer and heart disease, identify the major factors that they're contributing to that, and identify the highest payoff activities, you can dramatically reduce your risk of these preventable conditions with very simple interventions, as long as you have the time and the resources to do that. And can you see why an organisation is ideally suited to dramatically affect the life of their employees? Their life, but also their family's life and their family's health, especially their children's health. And we'll get to kids in a wee bit. The major actual causes of death, it's still tobacco, that's the number one. It's extraordinary. Some people still smoke cigarettes, so just poor diet and exercise, alcohol use. So those top three represent the vast majority of causes, and they are easily, clearly amenable to intervention. We can think of chronic disease as being a transferable or an infectious almost condition, because as soon as Western culture arrives in another country or a community, they catch the chronic disease bug almost. So we've got this explosion of obesity in children. Why is that? Have children suddenly become gluttonous and lazy? Have parents suddenly become irresponsible? Or are people being railroaded into this pattern of chronic disease that's actually transferable? You can think of it as infectious. And people are blaming parents for these fat kids. And really, the parents haven't changed. Genetics haven't changed. So what's changed? It's your whole societal structure has changed. And it's reduced activity, it's dietary changes, it's stress, it's PlayStations, it's a whole group of things. But and I think that's playing on parents too, with these really fat kids, and they're struggling and they don't know what to do with them. I'm going to skip past this one. This basically says that oh no, this is the cost one. Can I just say that it costs heaps? Chronic disease just costs an enormous amount, and the major cost really is the consequences of these chronic diseases. The consequences of heart attacks is very expensive, strokes are very expensive. All those downstream effects of these chronic diseases are what's costing the community, all of us, and the medical system a huge amount of money. Diabetes costs $132 billion in the United States a year. Smoking, 75. 300 billion was spent on cardiovascular disease. There's the increasing burden of diabetes. Clearly dramatic. There seemed to be something happened in the 80s, 90s, where it really started to pitch up. And that was quite a significant time for us, technologically. We started to get access to a whole lot of games and computers and Stranger Danger and a whole lot of stuff. And interestingly, there was a change in a particular food substance that was introduced around that time. And it's high fructose corn syrup. And that was added to that replaced sucrose in soft drinks. Now the interesting thing about high fructose corn syrup is that doesn't need insulin to get into cells. That'll flux straight into a cell and get converted to fat. So it's one of the cheapest but one of the most dangerous forms of sugar. And if there's one thing you could do to your kids, is ban soft drinks. It's the absolute number one thing. They've identified the major causes of obesity, and major intake of kilojoules is soft drinks. So that sugar that'll perfectly mirror that. There are obviously other factors, but that's a big one.
Is that just fizzy drinks, or is that the cordials as well?
All of them now.
Right.
Yeah.
So, I mean, was saccharin less harmful than...
Saccharin's less harmful. And I teach natural medicine to naturopaths, and they throw their pens at me. But really, honestly, saccharin is less harmful. It causes perhaps that much cancer, but the fructose is causing this much obesity and diabetes. So you've got to measure that up and decide, what are you going to do? The other option is to have fruit juices and other more nutritious things. Anyway, there's diabetes. Diabetes is something that is one of the future of medicine is going to be strongly diabetes focused, and 2.8% of all the people in the world have diabetes, and that's going to grow to 6.5%. That's almost 300 million in developing countries, who we don't typically think of. So if you're a global organisation, that's something you really need to be aware of. Now this is really alarming, and this is I'm really surprised that this hasn't come through the media. In China, when was it? Between 1986 and 1999, circulatory diseases increased about 200 to 300% in 35 to 44-year-olds. Anyone here in that age group? Large part of the workforce is in that age group. 200 to 300% increase in 13 years. Now that should send off alarm bells all over the world, and that's going to keep going. During the same period, cancer increased between 100 and 200%.
Do you think it's just because we are not eating as many whole foods and more processed foods? Just there was a simple thought about that.
Yes.
Is that a bottom line?
Diet is a major part of it. The low-fat concept didn't work. It didn't touch cardiovascular disease. So it's not low fat. If you have a low fat diet, you have to get your kilojoules from somewhere, and it's hard to get it from protein. All that's left is carbohydrate. So we become a carbohydrate consuming society.
But isn't it whole foods as in you're getting the husks, say like brown rice or white rice or whatever. So the body metabolizes a whole lot more minerals and vitamins than you're eating white rice or white food. Because that's that sort of the Western versus the old Eastern tradition.
Yes, certainly. I think that the major increase in carbohydrate is contributing to the cardiovascular disease. The whole food issue is probably more related to the cancer. A lot of the elements we have in food are remarkably anti-tumour. So when you move away from coloured fruits and veggies to a white bun and a slab of cheese, you're missing out on a whole lot of nutrients. Epidemiologically, we can't tease apart the impact of individual components of the diet very easily. So that hasn't been really well researched. So whole food is difficult. What is a whole food? I don't have the data on it. And so obviously it's a component. It can't not be. The change in the macronutrient ratios, however, is certainly a very, very big factor. And the more sugary, sweeter, lots more bread. Carbohydrate. I'll get back to carbohydrate. Is that too loud? Should I move it away a bit? Okay. The diagnosis of diabetes, most people have it in their prime of their working life. A lot of executives, I'm going to stick my neck out and say the majority of executives are close to pre-diabetes. And when you're a diabetic, you've got typically higher insulin levels. Now insulin has an interesting effect. It switches off fat metabolism. Because the insulin is saying to the body, you've got to use up your glucose, don't touch fat metabolism. And that's why obesity and diabetes are so closely interrelated. So if you can't burn fat, you're going to put on fat. But an important thing is this, is that we're all using fat as our principal fuel now. And if you can't get access to that, your energy levels, they drop. And we've got a program where we take people off carbohydrates there's about 20 grams of carbohydrate, which is very little. And we reduce their energy intake. And within 2 days, their energy just goes through the roof. They feel unbelievable. And the only reason is that they're switching on their access to their stored fat, and they burn fat. So carbohydrates are switching off your ability to access your major everyday fuel. And fatigue is one of the most common symptoms that when people are asked, they will say, yeah, I'm fatigued, I don't have a lot of energy, feel tired all day. And especially those people that drop at times during the day. Unfortunately, that leads to carbohydrate cravings. So they go for more carbohydrate, and then you're on a bit of a cycle. So diabetes is a very, very interesting one. There's a heap of it out there, and inherently it's so easy to make significant changes in people's glucose tolerance with minor changes.
Sorry, Brendan, so you're saying largely carbohydrate modified diets?
Very carbohydrate dependent diabetes. It's also fat dependent, and the initial research on diabetes and its impact on glucose tolerance led to the whole low-fat message, as well as its the saturated fat's effect on cardiovascular disease, which is eroded away over time, and we're certainly much more carbohydrate focused now. And if you have diabetes, it doubles your risk of death. So it's not a small thing, just your poor blood glucose. In the United States, it cost $132 billion. And I'll keep saying again and again and again, it's a preventable disease. It's unnecessary. It was unheard of in primitive cultures. Primitive cultures don't get menopause, they don't get dental caries, they don't get depression, they don't get so many things. And many
get menopause. Procreating to their death.
Now, menopause is a transition that they don't necessarily notice. When I say menopause,
they don't get,
they
don't get unpleasant side effects of menopause.
Yeah, they don't get what we associate with menopause. Yeah.
Are you sure they just didn't tell you what?
They don't even have a word for it. Kids don't get acne. A direct correlation between carbohydrate intake and acne. The high glucose floating around in your blood feeds the propionic bacteria that grow in your skin. Direct medical costs of diabetes was $92 billion. Indirect costs $40 billion. So it's costing the government a whole heap. You must have heard of the obesity epidemic in children. It's just all over the place now, and it's clearly an epidemic, and it's effectively contagious. I think we have to think of it like that. Obesity is usually now associated with poverty, even in developing countries. 3.5 million people are obese. I just zip past that one. It's certainly not due to genes, because our genes don't change over in 20 years. 55% of Australians are overweight or obese. 33% are currently dieting. And you will become obese during your lifetime. Overweight. Almost everyone. 75 to 80% of people will at some time have an issue with weight and get over that level.
What's the differentiation between being overweight and obese?
It's a body fat percentage issue. For men and women it's different. And I used to know the cut-off. The reason I don't have those figures is there's no line in the sand. It doesn't really exist. I'll have a punt, and I think it's 27% for men and 35% for women, percent fat. And then they're classified as obese. Obviously it's a clear continuum. There's another factor I'll get to in a second, is that it's the distribution of fat that's even more important. It's where do you put your fat on your body. So overweight is above 22 and 33 for women, and then it goes at 27 and 35, I think, something like that. The bottom line is the most important. The prevalence of obesity has tripled in the last 30 years, and it's going to continue to increase and drive diabetes, and it's really one of the major things driving these other chronic diseases. I'll flick through that. Now this is a great one. Each block of colours represents a different age group. So the light blue is the what happened in 1963 to 70. There were 4% 6 to 11-year-old boys that were overweight. And then it goes to green in 1971, that orangey in 76, 88 is yellow, and then whatever colour that is, purple, is 1999. So that's the increase in obesity in children. And we said before, they're not becoming lazier or gluttonous, or the parents are responsible. The families are being railroaded into this type of situation.
How do you assess that?
How do you, sorry?
How do you know? How do they know how many overweight young children there are?
The research has done it routinely over a number of years. So every age group in children has been increasing dramatically. There are a whole heap of factors, and no one's delineated exactly and apportioned the responsibility, and partly that's because it's different for different people. The major factors are diet, and that's largely carbohydrate based, but also we're eating more. Our portion size has increased. In fact, the plates in restaurants have had to be increased because people want to eat more in a serving. And if you've been to the United States and been to a restaurant, the size they give you is just extraordinary. So it's certainly macronutrient ratios, it's certainly portion size, and then there's the physical activity. And our lifestyles are so technologically advanced that our kilojoule requirement to perform our work has decreased dramatically of late. So we don't have to lift stuff, we don't have to go to places. We've become very, very sedentary. And so I feel that's a sociological effect, that people are being railroaded into the situation. And especially kids. If you're fat as a kid, it's very rare that you're going to live the rest of your life as a thin person. You actually change physiologically. You damage your ability to burn fats via a process called beta oxidation. It somehow gets mashed up, and that's it. You'll struggle for the rest of your life. So these people are going to go on and have diabetes very, very predictably, much younger than we've ever seen before. So that's why we're very, very concerned about the future, because of these kids coming along. And they're physiologically and behaviourally very unstructured, and the society is obviously hasn't. It's not going to change too quickly to correct it either.
When you talk about, you're talking about diet and serving size and carbohydrates, but where do you factor into that the change in home life and family life, where parents, both parents working, they're coming home, and these are children. I mean, we can't talk about they're not going to be as active at work because they're children. It's the parents' responsibility for the majority of that time to feed these children. So where does the family life and structure come into that, in that the parents are not taking the same, interest or care with what they feed their children?
Yeah, certainly. Family life is very important. It's a very unresearched area because there's a whole lot of elements. Certainly parents are spending less time with their children. They're spending more time working and generating an income. They're spending much less time cooking. A lot of units you can get now, they don't even have a kitchen. So that necessarily means the cooking has to be done by someone else, and that's always going to be an inferior food. So it certainly has a big impact, and the parents are responsible for that. But I'm reticent to blame parents, because this is across the whole community. You can't go out and blame everyone for being like that. The pressures on people have shifted us, family life, work life, away from good, healthy, fresh, various foods. And we were talking recently about food. You buy food in a restaurant, they've made it taste good. It's got sugar and salt and butter and all sorts of stuff. Very hard to not cook and find something healthy. What some organisations are doing is providing breakfast. When you get to work, you get breakfast made for you. And sometimes they're making lunch, and sometimes they're preparing a meal for the staff to take home to feed their family, for exactly the purpose you're saying there. Annie was telling me about that, and she didn't exactly say who, but what a fabulous thing to do, because the diet is a major part of it. Outside tobacco, your diet is a major effect, and the family life and works pressures and the ability to choose convenience is a big, big factor. So if convenience can be made healthy,
Yes.
fantastic.
It's definitely a holistic approach. So
Oh, it's everything, sure.
You know, we're in the natural skincare industry. I mean, whatever your body's skin you absorb 60% of, that goes to your lymphatic system, and you have to process that some way. If ingredients and products that affect your thyroids and all sorts of things which throw out your body, I mean, it's definitely, you know, application is in the home, and it's a way of life. It's not a, you know, we are very led by marketing in McDonald's. Your big brands of skincare and all that. There's no, people don't make,
Especially children.
They make fast.
Well, the target is children.
Yeah, absolutely.
So I was going to say something then, I lost it. I'll come back to that in a second. Yeah, the convenience. It's a societal structural change that's really responsible and affects family life and work life, and the expectations that kids have of what they eat. The foods have definitely changed. You can buy a hamburger now. I know a number of naturopaths have hamburgers. I'm not going to say where they bought it. They buy a hamburger from a franchise chain and sit it on their desk. And 14 months later, it looks like they bought it that morning.
That's on the Super Size Me where the chips didn't biodegrade. They just didn't. They just didn't. It was 9-10 weeks and nothing had happened to them. Nothing. What do they do in your stomach?
You can even sit ice cream in the sun and it doesn't melt.
Apparently, McDonald's is a fantastic company, CSR, right?
Yes.
But bread they use is classified as confectionery.
Food is classified as a confectionery because of
Bread.
bread because of the amount of sugar in it.
But you know, you look at the impacts that they're trying to bring through their salads and that's all sprung crisp. Like, you know, the reality is someone who's an intelligent human being and understands wholesome food wouldn't walk in there and eat unless they're starving.
Well,
Poor. So it is.
compare that to the other options, however. It's going in the right direction.
Yeah.
People don't like eating raw fish. People don't like paying for it. I guess at the end of the day, we've got to match what our outcomes are to what the real people out there are going to do. And if you've got an option between a meat and a sugary bun and a salad, I think it's a great option. But there are better options beyond that still. I think we have to start the trend moving in the right direction. And I think that's all happened surprisingly late. I would have thought that these salad options would have been here 10 years ago. But it'll move more in that direction in the future.
Not wanting to be overly cynical, it wasn't so much the health of the nation that prompted the change of salads.
Oh no, it was never
You know, ways of
public demand.
of increasing market share when they were missing out on a segment of the population. I mean, nonetheless, it doesn't matter what the intention was as long as the outcome is good. I want to preempt a question here, which is, do people not know that these things are doing them harm, or do they know and continue to choose to do them because on whatever levels it's easier, tastes better, what the hell? There's going to be drugs anyway and everyone else is doing it. You know, is it education or is it...
Well, it's certainly both. It's certainly, people do know deep down inside them. They know what's good for them, and yet they have short-term focus. They want something that tastes really good and that's convenient, so they will take that option. My feeling is that people kind of know, but they don't have the tools or the understanding of where to get the right stuff. They know they should be eating better, but they're not sure what, and it's just too convenient. People are under pressure, to time pressure, financial pressure, and their options are reduced, and over time people slip. Good intentions slip away.
Maybe there's there could be this is a radical thought. Adding to the curriculum, requirements for that teaching kids. It's in basics now.
And they do that. They're not allowed to sell coke in tuck shops.
That's
one of these
education, educating the kids rather than actually changing tuck shops.
Yeah.
Like, because what they're doing really are other sorts of ways of education in primary school.
I've educated my food, what makes no bloody difference whatsoever.
I look
Because
at,
other stuff, the sugar tastes good.
I look at 16 to 25-year-olds,
Yes.
so much the younger skewed, and mainly skewed to 16, 17, 18, 19-year-olds. You can sit and talk till you're blue in the face, because at that age they're all invincible, they're all taking party drugs, they're doing that. Only fear factor is vanity. You can be fat and ugly and pimply, they'll take notice. But if you think you're going to have, cardiovascular problems,
So it always comes back to marketing. The image and culture is marketed to them, and that's a big pressure, especially for these young kids. And as they go into their teens, very big pressure to. I mean, why would anyone start smoking? It's peer pressure exclusively.
Yeah, and that's obvious. I mean, everybody knows, even the people that smoking is going to kill you.
But
And so if something is so understood, I mean, you're really
so your individuals, the youth of today, they're very heavily marketed to. They're very socially aware. The only way to change them is to create a societal, cultural change. Now, can we go out there and change a whole community's culture? Frankly, I can't see it happening. Can you do that within an organisation? Absolutely. Just come back from Hong Kong with 3 days of 200 salespeople. I switched them on to their biological age like you wouldn't believe. They were desperate they were fighting each other to get appointments to come and see us. Whereas before they didn't think about it. They knew, but they didn't know. So within an organisation we can dramatically change the whole culture and attitudes towards vitality and longevity. And it's not about not being sick either. It's about being well. It's about being well, and it's about being well, but it's about living to see your grandchildren get married, living long enough to retire and go and still having not arthritis or a stroke and travelling the world and do what you really want to do. So we're very short-term focused. If we can stretch that long-term focus out, change the culture within an organisation, you can change people's lives, their families' lives, their children's lives, and their whole lives throughout time. Because when you're fat as a kid, you're gone. It's done already. Very hard to turn that around.
Just thinking in terms of the role of corporate, and comment somebody made about parents, family life changing, etc. The whole dual working partnership, I think, brings a radically different scenario to this, where there isn't someone at home cooking, and the role maybe in a corporate in valuing people's cooking time. It sounds really weird, but like for me to actually have the time to pick my small children up who have to eat really early because they go mad otherwise, and actually get home with enough time to cook something for them before they've gone feral is extremely difficult.
Yes.
And so I'm just brainstorming, allow that in that role that a corporate could play. One of the things is actually allowing people to have the capacity to cook.
Or cook it for them.
Yeah, I mean, that would look good if somebody would.
But how much does it cost the organisation? Not a good idea. It's so cheap to make food, isn't it? You're a chef. It's so cheap to make food. And if you can give people menu options, what a fabulous idea. Pick it up on your...
Hey, if I knew it was healthy, if I knew it hadn't been sitting in a bain marie for a week, I'd pay. There's places in Brisbane that do that actually.
Some...
and things like that.
So a company will prepare it for you and...
Yeah, Nourish. You can just order with them online or whatever, and you just go and pick it up. I mean, I don't ideally do that because I still like to freshly cook it.
Yes.
But it's an option that you've got. That's all sort of organic food, organic.
It's become very socially unacceptable to smoke, and there are some places you can't go and smoke, but you can just about go anywhere while you're obese. And I've got on airplanes, and they've charged me for excess baggage. And I mean, look at the size of me. I don't want any obese people on that plane because I'll feel gypped. That's terrible. Yeah, I did. I don't mind saying that. And I'm not pointing the finger at obese people as being responsible. I'll say it again, that people are railroaded into this type of lifestyle, and their choices are severely limited and constrained. And for some people, they're really boxed in. And these people have got no money, They're trying to get their kids in school. They've got diabetes. They're sick. And there was a program on CNN just recently of these communities in Chicago. They're obese. They're struggling. They're both parents have degrees, trying to get their kids to school, and they're thinking they're going to have to go into a refuge because they just can't get by. Now, you can't blame those people. That's a societal issue that people are around, and we're all in that situation to some degree. Not necessarily the poverty, but the time pressures, all that type of stuff is squeezing us into it. Obesity is as bad as smoking for your health. It's just as bad, and that's something that people don't understand. It's easy to fix obesity in a structured program. It's second only to tobacco-related deaths. There's a huge incidence of hypertension. Once you've got high blood pressure, what's your option? You take the medication, that's it. You get high blood pressure for the rest of your life. The reason for that is because hypertension damages your blood vessels themselves, which increases your blood pressure. Hypertension damages your kidneys, which increases your blood pressure. So once you get hypertension, you tend to jump up, and the major cause is obesity. Sorry?
What is high blood pressure?
Oh, sorry, high blood pressure. Yep. And obesity is the major driver. And when I get someone to lose a significant amount of body fat, and it's not a heck of a lot, the blood pressure always comes down, unless they've got end-stage renal disease. And this is the cause of the diabetes epidemic. It's obesity. And it's all of these factors we've been discussing.
Actually, I wanted to say to you, I've done a lot of work over the years for the health industry, market research work, and I know that doctors, as a matter of course, they pay lip service to, first, once you've been diagnosed with hypertension, if you can bring your weight down, you may not need to go on medication. And they sort of know that within a few weeks the patient's going to be on medications. They kind of inform them, give them that option, but don't believe that it's going to be effective. So,
well, it isn't effective.
Where is what you do in terms of making people believe that they can do something and it's worthwhile, different from what doctors don't do when they pretend they're giving people losing weight as an option?
Firstly, the research shows that when an obese person shows up to a doctor, more than about 2/3 of the time they don't mention it. They don't offer fat loss as a solution to that problem. Doctors.
What does that say? What does that say about the medical system?
But you're exactly right. What does it say about the medical system? And they don't say anything because even if they did, it doesn't change anything. The average consultation time is 6 minutes. What can you achieve in that time? Nothing.
Another appointment 2 weeks down the track. That's what they achieve.
But that's another 6-minute consultation. The doctors are railroaded into the system as well. So I don't blame doctors for a second because they get hammered if they have too many long consultations because it's too expensive. And the research, if you look at the research, and doctors have obesity initiatives, nothing. No negligible outcome because they're not in a position to achieve that. They don't have the skills, they don't have the time, and it just doesn't happen. So when someone goes to a doctor, the doctor is not able to help them with their obesity. So the medical system can't do the prevention here. It's just not possible. Dietitians, on the other hand, they're having good outcomes. But the patient of their own volition has to come back and see them and undergo the changes that are recommended. My suggestion is that in a corporate culture, if you can change the culture and thinking and attitude and the whole peer pressure and change effectively market to your organisation and its stakeholders, your employees and their family and their children, then you've got real potency in the time and the opportunity to dramatically change their lives. And when I say dramatically change their lives, I mean dramatically change the way their lives are going to play out. It's no fun having a stroke. Diabetes is causing kidney disease and amputations, and we're going to see that go through the roof. So I really feel that that's a real strong opportunity. No one's really taken it up. When I say no one's taken it up, they have done some things, but I see a lot more, and I might talk to you about that a little bit later. So obesity is the cause. Most diabetics are overweight. That's very, very clear. One thing that people don't realise is all of the consequences of being overweight. They don't know that their kidneys are going to be hammered. that they're going to get dramatically advanced cardiovascular disease, increased risk to stroke, or even cancer as a major cause of. And why did cancer increase in China so much? Certainly it was the food changes, but its major part is obesity. So the programs that are being used in organisations now, I don't feel are very effectively isolating each individual's highest payoff risk factors and targeting those. Forget the rest. Pick the big one and achieve a little win, and then go to the next one. That's really what executive performance is about. We're doing a whole range of assessments, coming in, finding the highest payoff, fixing that, and then moving on, developing a treatment plan and addressing it in a structured way, which is not happening in the community. It's not happening in hospitals, it's not happening in doctors. The only place it's not happening in schools. That'd be the other place to do it, but it's not happening there. The organisations, I feel, are a good place to do that. Lifestyle causes most cancer. This is an interesting thing. Obesity is predictable. Just have a read through this one. Modern obesity is a highly predictable biological response to our new environmental conditions, because they're changing so dramatically, and is not abnormal pathology. This raises the worrying specter of billions of pharmaceutical dollars being invested in discovering a cure for normal physiology. A cure for normal physiology is interesting, isn't it? So you can't fight this thing. It's your body's natural response. And the only way to do it is to have abnormal physiology, which is sickness. And that's the outcome of pharmaceutical therapy a lot of the time, are the side effects. The World Bank suggests that globally 12% of the healthcare budget is spent on obesity, and that's going to get worse, and it's going to overwhelm our wealth, as well as our health is going to go down, because we're going to spend more and more dollars on health while being sick at the same time. And my major concern is those dollars are going in the wrong direction. It hasn't worked for the last 30 years. Why is it going to start to work in the future? It's a completely different thinking approach, and it's cultural, it's marketing, it's a much bigger issue. All these slides will be available a little bit later. I'm not going to go through these, but it's lots of dollars. You can see them all there. There's another one. This is an important one. The cost to business of obesity. The obesity is actually costing the organisation some money, and it's a stack of money. So I'm going to leave that and just skip through. We're a little bit running.
That's due to absenteeism? Or?
That's due to poor productivity, to absenteeism. These are US figures, so they in the US medical insurance. Yeah. And injuries, that's the other one. Obese people are fatigued. I mentioned that a little bit earlier. You can't get access to that fat store. And when they do exercise, they get fatigued really quick. If you want to get people to lose weight, it's diet first and then exercise. If you're going to do one thing, you do diet first. And I'm a big believer in targeting on the highest payoff thing, and it's diet. One of the reasons, even though it's not, is sleep apnea. Sleep apnea is related to snoring, but it's not snoring. It's when during your sleep you stop breathing, and and it's strong in males, especially with visceral, the fat around the abdomen, and you stop breathing, and that switches on your nervous system, and you're in a semi-awake state to get your breathing back again. So through the night you are aroused repeatedly. Some people up to 100 times a night, and you wake up and you just feel like death. You just feel like you've not slept at all. And a lot of these people are dragging themselves through their lives and just have very little productivity. I work with a guy that I said, "There's something wrong with your eyes." I said, "Why is that?" "Because you're trying to focus." And his head's going like this, but his eyes are closed. And there's a lot of sleep apnea out there. And obese are more absent. Twice as absent as lean people. I just want to show you a few things. There's a big societal cost, big personal cost. That was the comment I made previously, that most people throughout their lives become overweight. And that's more due to their loss of muscle mass, which we're testing out there. Stressed people eat more. On the left-hand side are people that produce more cortisol which is a stress, you release cortisol when exposed to stress. People that release high cortisol are highly stressed and reactive. So on exposure to a standard stressor, you can assess their cortisol levels. They're either high reactive or low reactive. And high reactive people eat twice the amount of low reactive people. Part of that is that carbohydrate has a mood altering effect. And you may have seen some of the Super Size Me. Dramatic effect on mood, and you become irritable and agitated. And part of that is because your blood glucose is going like this, but also because it has an effect on your serotonin, your mood. What do you call it? It has an antidepressive effect to some degree. Even though it generates a poorer mood, the carbohydrates themselves have a mood elevating effect. Was someone going to say something there? No? This is the distribution. People with body fat in here. If there's two places you store fat, down around your hips or around your gut. If it's around your gut, you store it under the skin, and that's soft, and you store it under the muscle, and that's hard. I used to work with a big fat farmer, and he said, it's not fat, it's muscle, feel it. And it was hard. And that's because it's packed under the muscle, and that's around your organs, and that's the absolute worst. If you decide to have liposuction, can you see the fat up here? In liposuction, they take that away, but see what still remains. The fat in the organ remains. So we can't get to that. There's too many nerves and blood vessels and all sorts of stuff in there. You'll damage stuff. So when you have liposuction, you don't take away the most damaging fat, and that's under the muscle around your organs. And stress specifically directs fat to be stored in that partition. As you get older, your fat gets bigger, your muscle gets smaller. And that's one of the major reasons that we're testing out here. We're testing your biological age, because it's a very strong predictor of how you're aging, where your muscle is up to. There are some normal weight individuals that look perfectly fine, and we call them sarcopenic, because their muscle has wasted away and the fat has taken its place, but they still look okay. And they're at a high risk of diabetes and cardiovascular disease. They're called metabolically obese, normal weight individuals. And the BMI doesn't tell you that. Body mass index doesn't tell you that. Weighing you doesn't tell you that. A bioelectrical impedance analysis does tell you that. It tells you muscle to fat ratio. And if we take your waist measurement, we can also tell whether you've deposited fat around your organs or not. So these are the type of testing procedures that really the organisations are crying out for. They would if they knew that they were available. So that's my mission, to get this type of stuff into organisations and change that culture in a situation where we've got serious marketability, I think.
Sorry, just on that previous slide, you talked about the figure on the left, but then the pear-shaped on the right, the female one, is that good fat?
Yeah.
Is that it, right? Where it's not...
It's not great fat.
Your organs.
But it's okay fat.
I like that.
Yes.
Where it's outside the muscle,
yeah,
as opposed to under the muscle.
So women store it here,
yeah,
because it turns over very slowly.
Right.
The fat in your organs are donating triglycerides to your blood very, very rapidly.
So if there's, on that side, is that because the fat is stored on the outside of the muscle? Is that the cellulite thing?
No, cellulite's a little bit of a different issue.
Right.
So they're actually the fat inside around your organs has slightly different cellular membrane characteristics to the fat outside. So it behaves a little bit differently, and the fat around your organs is shedding more fat into the tissue and causing more diabetes. For the same amount of fat here, you will get diabetes here more readily.
Okay. So the figure on the right,
it's okay.
Isn't in the organs as such.
No, it's under the skin.
And the fat that's in your belly, it's almost being classified as another organ these days called the omentum. I don't know if anyone's seen it. Recently, it's true. You think about momentum.
Okay.
And Dr. Ward did and held it up. And it's difficult. It produces different hormones, produces different chemicals, and that's hard for the
I've got to wrap it up, so I'll just say a few more points here. Is that poor people eat poorly, and they've got this concept, or we generally have this concept that if you eat healthy, it necessarily has to involve Brussels sprouts and soy milk, and that's not the case. It costs, luckily in Australia, it costs the same amount to eat healthy as it does to eat unhealthy. That's not the case in the UK and the US, where it's actually cheaper to eat unhealthy, unfortunately. So poor people are making poorer choices with respect to their diet. So that's an education thing, as much as a cultural peer pressure type of thing. I mentioned this earlier, that low fat effectively equals high carbohydrate, and then there's a number of slides there on cardiovascular risk. 90% of Australians have one or more modifiable cardiovascular risk factors. 90% modifiable risk factors. That's just absolutely extraordinary. That we have unconsciously chosen as a society to be in that situation unnecessarily. And the amazing thing is everyone knows. Everyone knows their cholesterol's not great, their blood pressure's not great, and diet and physical activity will fix it 99% of the time. So why don't they do that? Stress is part of it, but my feeling is they don't have the structures to encourage and motivate and support and educate. And within an organisation, within a school, perfect situation to do that. My strong feeling is that is the only solution. So that's my little thing.